Hi, good evening, everyone. Let's go ahead. So far, we completed with our aphorisms up to 37. We are going to start with the second case of dissimilar diseases meet together from aphorism 38 and 39. Now, what we discussed, just we have a recap. We discussed about the first case when somebody is having an illness, and while having that illness, if he is going to get another disease which is almost of a equal strength or weaker than the existing one, what all is going to happen? What all is going to happen is that the weaker one, the new disease which is weaker, cannot take over already existing stronger or equal disease. In that case, we can have some 3 4 examples in this aphorism where we come to know that in rachitis, that is rickets, Jenner told, does not allow vaccinations to work. If the child having rickets, if that ricket child is given vaccination, the vaccination will not be taken. Like this, there are many more examples. And similarly, understanding this interaction of the diseases, if we see the allopathic way of treatment, that if disease is the stronger one and mild dissimilar allopathic medicines are given, they will not be effective. As I gave you nowadays the example of cancer, if you treat with antibiotics, it is not going to help much. So, having understood the first case, let us just go ahead with the second case. What is the second case? What happens within the second case? Hanuman says the second case means when he is starting, either the first case may happen, or he starts with the aphorism, or the new disease which is dissimilar to the existing disease in an organism, and this new dissimilar disease is stronger one, then what are the conditions, what are the situations going to happen, what is going to be transpired? That is all we are going to learn in this aphorism. And similarly, on these lines, if treatment is given, dissimilar type of stronger treatment given to the existing disease which is weaker, then what should be the situation occurring out of this? That we will be learning from aphorism 39. In this aphorism 38, he is straight away teaching us the whole scenario with some 10 examples. He is giving us some 10 examples, that how with these 10 examples we can understand that if the existing disease is weaker than the new dissimilar disease which has come, what all is going to happen. So let me just go ahead with the aphorism. Aphorism 38, case 2, or the new dissimilar disease is the stronger. In this case, the disease under which the patient originally labored, suffering, labored means he struggling, being the weaker, will be kept back and suspended by the accession of the stronger one until the later shall have run its course or been cured, and then the old one reappears uncured. This is something important to learn. Never mind, the new disease is stronger one. What all is going to do? It is going to suppress. You may feel as if the old one has cured because It is not expressing itself in the signs and symptoms. And that means it got suspended. And this new, stronger disease will run its course. And once the course is over, what is going to happen? The older one will now restart its course, reappear, it just stop its. In this case, the disease under which the patient originally labored, being weaker, will be kept back and suspended by the accession of the stronger one until the later, means the stronger disease which came uh, later, shall have run its course or being cured. Means when this newly stronger disease completes its course and cured, then the older one reappears uncured. And this is generally seen with the acute, mainly acute kind of conditions. Now let us have the examples. So I just go one by one. There are 10 examples we are going to have. The first example is, I just tell all those 10 examples first in one go, then we will be reading them. The first example is ringworms suspended epilepsy. Then the second example is scurvy suspended the itch diathesis. Typhus suspended pulmonary tuberculosis. Mania suspends pulmonary tuberculosis. Fifth example is smallpox suspended measles. Then sixth example is measles suspended the formation of pox pustules following smallpox vaccination. It is an interaction between the measles and smallpox vaccination. You know, when you prepare a vaccination, it is been attenuated, it has been made weaker. Cowpox suspended scarlet fever, and scarlet fever suspended cowpox. Then another example, measles suspended cowpox. Measles suspended smallpox vaccination. Smallpox vaccination suspended mumps. Like this, we have 10 examples. Let's go one by one. So Henling says in Aphorism 38, the first case is two children affected with a kind of epilepsy remained free from epileptic attacks after infection with ringworms, that is tinea. But as soon as the eruption on the head was gone, the epilepsy returned just as before, as Tulpius observed. One authority he's quoting and putting a footnote. In the footnote, he has given all those references from which he has taken it. So it is quite clear that he is quoting the example that these two diseases, see, every one of you doctors, and when we are naming the disease, you understand what is this. Or the best way will be, let's just read the symptoms of epilepsy and symptoms of tinea, ringworm, and we may compare. Are they having any similarities? We understand what happens in the epilepsy and what happens in the ringworm. One is a disease of the nervous system and leads to some kind of, you can say, uh, tonus clonus spasms. One is a spasmodic disease, and the other one is a skin disease where you find mainly very severe itching and skin lesion with some red ring-like eruptions. And once this is gone, the tinea is gone, epilepsy comes back. You may ask a question that what is the way of comparing these diseases, that how one is stronger than the other? See, this is what Hahnemann is putting the examples with the authorities they have observed. There is no such kind of parameter to say that this disease is this criteria goes weaker and with this criteria goes stronger. This has been observed in the cases, and not simply Hahnemann observed. He has quoted some authorities, and imagine if Hahnemann is putting them in the organon, and in the organon he is putting them in the aphorism text. You can understand how reliable will be the source and how reliable will be the point to understand. So, as such, if there is any criteria which is going to tell that on that basis this particular disease becomes weaker or stronger, is, at least I do not know. But what I understood is that it is the observation of some experts which Hahnemann has quoted, and obviously Hahnemann also must have observed the similar thing. And not simply once, he also must have observed this many a time. And then only he is believing the authority and putting it in the text of the organon, especially in the aphorisms. So we are to understand this according to the observations, not simply going to know some criteria. So this is an example we can see. The next example we can see, the itch. The next example is scurvy suspends the itch diathesis. Whatever is the itching, because of whatever may be the reasons, the itch diathesis, whether it can be any kind of mm, itching because of any kind of infection. The itch, as chop saw, disappeared on the occurrence of scurvy, but after the cure of the later, it again broke out. So, whatever may be the reasons, there are some kind of itching which is coming, whatever may be the causative factor behind that. This itching comes if somebody is suffering with itching, and at the same time he is now suffering with scurvy. You understand, scurvy is a disease where there is a deficiency of vitamin C, and because of which you get spongy gums, you get weakness and many other symptoms. And when that scurvy comes, then scurvy takes over and this itch suspends. As soon as the scurvy is going, then what is happening? Then definitely the uh, itching is coming back. So the itch disappeared on the occurrence of scurvy, but after the cure of the later, means the scurvy itching again broke out. Another example. So also the pulmonary thysis remained stationary when patient was attacked by a violent typhus, but when on again after the later has run its course. So it is a interrelationship between the pulmonary thysis and the typhus fever, a violent kind of fever. When this kind of somebody suffering with the pulmonary tuberculosis, when he is going to get a violent typhus like fever, this typhus fever when comes, immediately what happens, that has been observed, that all the symptoms of the tuberculosis, they get suspended. You will not be able to observe the symptom. Does not mean that disease has gone. No, rather it has been superimposed by the symptoms of the typhus fever. And as soon as this typhus is cured, run its course completely, went off, and again this pulmonary tuberculosis symptoms which were suspended, they will be back with all its symptoms. Then another example, if mania occur in consumptive patients, when you say consumptive patient means tuberculosis patient. Consumption means tuberculosis. Why it is called consumption? Consumption means when you're consuming something. The disease tuberculosis means that a disease which consumes you, because the person suffering with tuberculosis, how he is becoming? He is becoming thin and thin and thin. So if mania occurs in a consumptive patient, the phthisis means tuberculosis with all its symptoms is removed by the former. But if that go off, the phthisis returns immediately and proves fatal. Somebody who gets an attack of mania, a kind of psychiatric disease, and the person who was already having tuberculosis now gets an attack of mania, what is going to happen? Mania is going to superimpose with the symptoms, and all the symptoms of the tuberculosis, they will be suspended. The very situation, it is such a situation that one who is a very casual observer, such casual observer will feel as if because of the mania, tuberculosis is cured. But that's not the case. It is not cured. It's just suspended. And as soon as this mania passes off, all the symptoms of the tuberculosis will be back. And what happens this again when tuberculosis is coming back, it is seen that it then proves fatal. There is a footnote in this, proves fatal, of footnote 5. Mania, phthisis, supervenes, and the reference, he has given a reference in a different language. Must be the Latin. So let us take the next example. When measles and smallpox are prevalent at the same time and both attack the same child, the measles that has already broken out is generally checked by the smallpox that came somewhat later. This is also possible that smallpox and measles, nowadays no such smallpox, but then earlier cases were observed when measles and smallpox epidemic going on and a child gets attacked by both, and just measles came a little before than the smallpox, and already the symptoms of the measles started. Then smallpox came. What is going to happen? That measles symptoms will be suspended and symptoms of the smallpox will superimpose. And once when smallpox will complete its course and go away, then now measles symptoms will start coming and completing the course. So this is the example when measles and smallpox are prevalent at the same time and both attack the same child. The measles that has already broken out is generally checked by the smallpox that came somewhat later. Nor does measles resume its course until after the cure of smallpox, but it not infrequently happens that the inoculated smallpox is suspended for 4 days by the supervention of the measles as observed by Mengett. And in this similar situation, if suppose there is an interaction between the smallpox vaccination and the measles, then situation will be altogether reversed. Because you understand, when you give a vaccination, inoculation is a vaccination. When vaccination is given, in that always that particular disease component, it is made attenuated, made weaker, so that it should not cause the serious disease, but then somewhat of the disease is produced. So it is also a kind of disease, but by inoculation, not by nature. So in that case, because now smallpox vaccine is a weaker one then compared to the measles, now then measles will run its course first, and the vaccination occurring means until and otherwise vaccine showing certain symptoms, it is understood that vaccine has not been effective. And this effectiveness features, symptoms, they will run afterwards. They will come afterwards when measles will complete its course. As observed by the Mengate, after the desquamation of which the smallpox completes its course. So it is the both way that how that disease is became weaker in the vaccination, the smallpox, it will be superimposed by the measles. Even when the inoculation of smallpox had taken effect for 6 days and the measles then broke out, the inflammation of the inoculation remained stationary and the smallpox did not ensue until the measles has completed its course of 7 days. Means what happens that smallpox inoculation, where how it is given on the skin, and ultimately it produces some kind of pox marks on the part where the inoculation is done. Such marks, they are unable to appear. They should appear by the seventh day after the inoculation. But on the sixth day, if suppose measles attack has come to the child, that marks, pox marks of the vaccination, they will suspend to develop. And what is going to happen now? First, measles will run its course. And then after that, this pox marks after the inoculation will develop. Then only you will come to know that vaccination is taken. Just imagine how two dissimilar diseases meet together. The stronger one, which came later, may suspend the existing disease, which is weaker, but then does not really cure it. But then, very casual looker, very casual observer might feel that it has gone, but it has not really gone. It is coming back. As soon as you are going to finish, you are going to see that the stronger disease which came later completing the course. Going further, in an epidemic of measles, that disease attacked many individuals on the fourth or fifth day after the inoculation of smallpox and prevented the development of smallpox until it had completed its own course, whereupon the smallpox appeared and proceeded regularly to its termination. So it is the similar case which we discussed, that whenever if you compare the vaccination of the smallpox and the measles, if measles is already going on, And if you give the vaccination, the taking place of the vaccination will be after the measles course is over. And many authors and many of the authorities in the time of Hahnemann have observed that, and he quoted all of them here. Then the next example, the true smooth erysipelas looking scarlatina of Sydenham with sore throat was checked on the fourth day by the eruption of the cowpox, which ran its course, and not till it was ended did the scarlatina again established. So it is called Scarlatina of Sydenham because Sydenham, one of the Middle Ages well-known physician of the Middle East of Asia, he observed it first time clinically. So it is from those days named as Scarlatina of Sydenham, simply known as Scarlet Fever. And nowadays we understand it with the name of strep disease, streptococcal infection, streptococcal disease. Those days, hardly anyone was knowing streptococcus and all, and how it is causing disease and everything. We came later after Hahnemann, and that is why Hahnemann is only naming as per its authority who observed it in the history. Sydenham. So whenever somebody is suffering with scarlet fever, which is a typical presentation of sore throat, fever, and all those, every symptom of it, you can just check up. Now, when such person suffering with scarlet fever, if he is going to get an attack of cowpox comes from the cows and the cats also. It rarely comes to the human beings, but then it can come. And once when it is coming to the human being already suffering with the scarlet fever, then at that time, what is going to happen? All the symptoms of the scarlet fever, they are going to be suspended. And once it is suspended, then the whole course of the cowpox will run. Once that course of this cowpox is over, then again this scarlet fever resumes to complete the course of that. So this is how the interaction of the diseases occurring of dissimilar in nature. Definitely, the first case which we studied in the 36 and 37 aphorism, 36 aphorism mainly, if the existing disease is stronger, does not allow the new dissimilar disease to come. But in the second case, when the new disease coming stronger, it is going to suspend the existing disease. And after when it is going to suspend the uh, earlier disease, completing the course of the new disease came later, and then it come back. The earlier disease again comes back because it was under suspension and not cured, which sometimes the very casual lookers will ignore. So next, the next is the true smooth erysipelas looking scarlatina of Sydenham with sore throat was checked on the fourth day by the eruption of the cowpox, which ran its course, and not till it was ended did the scarlatina again establish itself. But on another occasion, as both diseases seems to be of equal strength, the cowpox was suspended on the eighth day by the supervention of the true smooth scarlatina of Sydenham, and the red areola of the former uh, disappeared until the scarlatina was gone, whereon the cowpox immediately resumed its course and went on to its regular termination. You see, the surprising thing that these two diseases, according to their stages in the earlier phase, The cowpox is stronger on the sixth day, but then later on, after some 8 days or somewhere, the Scarlet Fever becomes rather more stronger, and then it just suspend now relatively weaker cowpox and completing the course of Scarlet Fever, and then thereafter, what is happening? The cowpox running its course. So, as I told you earlier, that it is no such criteria or a rule to say X disease is weaker and Y disease is stronger. It's not like this. Even it depends clinically that on what particular day the same disease is weaker in comparison to the other disease, and the other disease on particular day becomes stronger than the previous one. So it may vary clinically with the situations. So we are not to go to find out some kind of criteria, rather let us go with the observations. And we also need to observe in our cases where, if suppose a patient is going to be affected with two disease, uh, one after the another, it is not that every person is going to have such conditions. And as we are seeing, whatever the diseases we are reading here mostly are of acute in nature. And in the acute in nature conditions, what happens when two diseases meet together? In that condition, the later one is stronger, the previous is going to be suspended. But one thing you will see, so far Hahnemann did not say they both the disease, both the diseases, they do not join together. They never form a conjoined melody. They do not make a complex disease. So, in acute conditions, so many examples we are seeing, and Hahnemann will be telling this later on, that this is possible, that such two acute conditions, they may come one after the another in a person, and one disease may be stronger, the later one may be stronger, but at times they are of the similar strength. And when we say the similar strength, equal strength, then at particular day a may be stronger, and at particular day B may be stronger. So whichever the day, the one who is stronger will suspend the other one. This is what the main point to learn, and will not cure either, and will not make any kind of complex or a conjoined disease. This is not happening. So going further, the another example, the measles suspended by the cowpox on the eighth day. When the cowpox has nearly attained its climax, the measles broke out. And in now another thing, the cowpox now remained stationary and did not resume and completes its course until the desquamation of the measles has taken place, so that on 16th day it presented the appearance it otherwise would have shown on the 10th day, as Scortum observed. Again, interaction of cowpox and the measles. According to the day, one becomes stronger and suspend the other. This is what the crux of the whole thing. The crux of the whole thing is that interaction of the diseases were observed, and it is seen that if two diseases which are very near and equal strength, on particular day one becomes stronger, and on another day the same become weaker in comparison to the other, the whole thing is the one who is weaker will be suspended. This is what is the main understanding we need to learn out of this. Even after the measles has broken out, the cowpox inoculation took effect, but did not run its course until these measles has disappeared. Now, in the same this measles and cowpox, if you compare the cowpox vaccination, which becomes weaker in comparison to the measles, if measles is running, cowpox vaccination will not be taken, will not be showing its effects until and otherwise the measles is completing and finishing its course. Now, Hahnemann says, I myself saw another example, the mumps. You understand mumps? It's a viral infection of the salivary glands, parotid gland, and causing pain here, and difficulty in swallowing, fever, body malaise, body ache, and all those symptoms. I myself saw the mumps immediately disappear when the cowpox inoculation has taken effect and had nearly attained its height. It was not until the complete termination of the cowpox and the disappearance of its red areola that this febrile tumefaction of the parotid and submaxillary glands that is caused by the peculiar myasm reappeared and ran its regular course of the seventh day. So it is an interaction between the mumps and the cowpox vaccination. When this vaccination of the cowpox is given and already patient was suffering with the mumps, it will be suspended till the complete effectiveness of the cowpox vaccination is seen by making that pox mark areola formed because of the vaccination, and once that is over, then only the mumps will come back to run its course, which is caused by a peculiar myasm. Just imagine. Henman is hinting towards that state of infection which is caused by a particular virus, peculiar myasm. Finally, he's concluding this case, this aphorism, and thus it is with all similar, it is all with dissimilar diseases. The stronger suspends the weaker, but they never cure one another. See the italics. It is italics. It is not that very simple words. All simple words are rather very important, but then something becomes even much more than the simple words, means much more important than the simple words. Even when he says something in the italic, that just bear in your mind that if the later one is stronger, not going the cure to the this brackets what he writes acute diseases. So when there is a condition with the acute diseases interaction, you will not find that they are going to make any kind of complex, any kind of conjoint disease, any kind of complication with one another. This is not the case here, he has described. So, this is all understanding with some 10 examples he has given, in which he has covered many diseases, even some of the vaccinations, but you can observe that most of all of them is some kind of acute diseases where you will find the interaction is taking place, the one is getting suspended when it becomes weaker, and the other one, which is relatively stronger, takes over to run its course, but they never complicate to each other. And second thing, that no one is curing the other. So bear in that no such cure take place with the dissimilar. And in acute, no such conjoined or complex disease is found. Let's move on to the next aphorism, which is very well connected. Until we read it just now, we read it, learn it now only, then it will be difficult again when we are going to take up these 39. We are to again understand 38. So, in continuation with this, we understood that dissimilar are not curing but suspending. Now, what is happening with this situation when you treat somebody with the dissimilar, stronger medicines? The first case we learned dissimilar treatment but of weaker medicine are not effective. But now, what is going to happen? Very obvious. If you give some stronger medicine to a weaker disease, both are having a dissimilar relationship. Definitely, the disease will be suspended. The previous disease will be suspended, and as it has been seen in the last 2500 years, that uh, very casual lookers and observer felt that they have cured it, and that is still continuing. You will just see this. The same thing is happening nowadays with this acute disease going around. In this aphorism, we will find some four examples of all this. Now, the adherents of the old school, now the adherent of the ordinary school of the medicine saw all this for so many years, 2500 years. The same what we have just now understood about the dissimilar diseases interaction. The stronger one suspends the weaker. Be it ever so strong, if the new disease be dissimilar and stronger to that already present in the body, what shall we think of them? That they nevertheless went on treating chronic diseases with allopathic remedies, namely with medicines and prescriptions capable of producing God knows what morbid state, almost invariably, however, one dissimilar to the disease to be cured. For last so many years, what are they doing? They are just producing a dissimilar disease. Nowadays, what are they doing? In the name of killing the virus, they are producing some very strong dissimilar disease. If you ask patients, those who have undergone the antiviral treatment for this present virus, they will be told that we are giving you certain medicines. You will be suffering with vomiting and all those many symptoms, and you should not worry about this. What does it mean? That they are producing in the name of killing the virus some dissimilar disease, and it is simply suspending, because when they are coming back, they are still on some low oxygen treatment. They are still with this or that so many symptoms. Actually, they are not really cured. You may say that some transformation had taken place. We will learn in this aphorism further. And even though physicians did not hitherto observe nature attentively, the miserable results of their treatment should have taught them that they were pursuing an inappropriate, a false path. So this is quite understood. The way the treatment has been going on was nothing but pursuing an inappropriate, a false path. Did they not perceive when they employed, as was their custom, an aggressive allopathic treatment in a chronic disease, that thereby they only created an artificial disease dissimilar to the original one, which, as long as it was kept up, merely held in abeyance. So, with that, when you are giving a medicine which is producing a dissimilar, stronger disease, it is putting the previous disease, it is putting that natural disease at the abeyance, means in a suspension, merely suppressed, merely suspended the original disease, which later, however, always returned and must return as soon as the diminished strength of the patient no longer admitted of a continuance of allopathic attacks on the life. So this much is this much up to life. This question mark when he's putting, this much is the understanding of the main point he's talking about the allopathic way of treatment. You may ask a question that the previous aphorism, what we learned 38, he is talking about the acute diseases interaction. Here he is talking the treatment of the chronic natural disease with some stronger allopathic dissimilar kind of medicines. Why? Because acute disease has got a character that it has a certain period, it has a course. It will just come, complete course and go away. Or what all you can do is with right homeopathic medicine, you can shorten the course. Like for example, what is happening with the COVID-19 when you are giving your indicated medicine, if it has to run for a longer period, you are just reducing the course within some 2 to 4 days, it is over. Maybe some 1 2 day more. And in some, this very virulent, very violent infection is immediately going and blowing up the whole of the uh, hidden and slept chronic miasm. And in those, when this, it is not simply transient explosion of sora, for some cases, it is a complete explosion of the sora, or you can say the chronic miasm. When it is completely blown off condition of the miasm, such patients are in a very, very serious conditions. And because they are unable to get the right homeopathic medicine, they succumb to the disease and they say that he died with the COVID-19. Otherwise, those who are just with some dissimilar kind of medicine in the name of killing the virus, what is happening? That under the cover, that disease is completing the course and that medication is simply blanketing up the symptoms. And then patient is coming out. Now he is laboring with chronic explosion of the sleeping miasm, which is now waken up by the somewhat by the disease and mostly by the treatment given. And they are going to be the potential patients of homeopathy now, because enough is taken by them, enough suffering has been taken by them, the by the prevalent medicine. So from here onwards in this aphorism, he has taught us the kind of treatment people are getting. People are getting very nicely the understanding of this area of the treatment of allopathic way of medicines. They are stronger dissimilar medicines, and in the name of correcting some biochemical changes, in the name of correcting some kind of other you should be giving a medicine to increase lymphocytes, and you are simply doing something to increase the lymphocyte, you're doing something to reduce the ESR, you are unnecessarily meddling with the internal operations of the vital force and messing up with the case. Not really required. It is a killing. It is a very brutal killing of the innocent patient. Patient is always innocent. He obeys his doctor like anything. And whatever the killing we are doing, we are charging them. We are killing but charging them. It is a double killing, not killing of the patient but the whole family. So now we are going to have some 4 5 examples. Let us complete those examples. That is going to make us things much more clearer. Thus, the itch exanthema certainly disappears very soon from the skin under the employment of violent purgatives frequently repeated. When you say itch exanthema, it is a kind of like measles like situations. All those exanthema is one, all those kind of uh, diseases, you can say, where patient is suffering with mostly with the itching and some kind of fever and all. So in that case, if you treat earlier, not really now, but then earlier, the treatment was giving them some purgatives so that you will be clearing your stomach. You must be hearing all diseases are due to the reasons of the abdomen, and let us give you some medicine so that your stomach, your bowels become clear. Means you should get some diarrhea. Once you get some diarrhea conditions, the things will be all right. So those days earlier, I don't think now it is done. Some kind of purgatives are given, and with that purgative, the itch goes, means suspended. Not really goes, but then it's suspended. Thus, the exanthema, itch exanthema certainly disappears very soon from the skin under the employment of violent purgatives frequently repeated. But when the patient can no longer stand the factitious disease, that is the purgatives of the bowel, and can take no more purgatives, then either the cutaneous eruptions break out as before, or the internal sora displays itself in some bad symptoms, and the patient, in addition to his undiminished original disease, has to endure the misery of a painful, ruined digestion and impaired strength to boot. So, what is going to happen with him? He's now going to have so many of suffering with this kind of treatment. How? One, he's gone weak because of the purgatives and cannot take any more purgatives. Skin symptoms again came back. And since he has gone weak because of the purgatives, so much of diarrhea, and because of that, some kind of slept sora or the myasm this started awakening. Because of that, wherever the damage is done in the bowel, in the abdomen, there only this slept sora started arising, and now you are suffering with so much of gastrointestinal issues, chronic issues. So you were treated for one disease, but you are gifted another one. Now you are suffering with a disease which was already there. Secondly, that treatment has given and made you weak, and the old slept diseases in the name of Sora started arising right from your stomach. And because you're weak, your body system is unable to boot you. You understand, boot means unable to give you further kind of improvement. Your body system is unable to help you. Your vital force is now really able to, not really able to boot you. It is almost the same meaning as you understand for your computer, for your laptop, for your mobile. It is unable to boot you, means unable to make you better, unable to make you, help you to do something better. So also when the ordinary physicians keep up artificial ulceration of the skin and issues on the exterior of the body with the view of thereby eradicating a chronic disease, they can never, just mark, it is capital, they can never attain their object. By doing so, they can never, again capital, cure them by that means. As such, artificial cutaneous ulcers are quite aligned and allopathic to the internal affection. So there are some more chronic conditions that in the time of Hahnemann, not really now, there were some ways of treatment by putting issues. What is issue means? When you put some kind of metallic thing in your muscles or the subcutaneous tissue, and they just put it there only, so that you keep oozing out of this some fluid in the name of removing the disease out, and you are treating by this way some chronic conditions. but they never Hahnemann says in the capital twice it cannot cure. And because that applying this kind of issues is allopathic to the conditions, chronic diseases patient is suffering with. But in as much as the irritation produced by several tissues is at least sometimes a stronger disease than the indwelling malady. But those indwelling malady, those chronic illness, they are somewhat weaker than this issue put in the tissues. So they are getting suspended for some time. The later is thereby sometimes silenced and suspended for a week or two. So, because of some period suspension, the very casual observer feels that it was effective. So, he will say that let us put two issues. One issue is effective, but for a lesser period. Let us put it two together, different part of the body, to means to make the disease more stronger, make the dose more stronger. But it is only suspended, and that for a very short time, while is the patient's power are gradually worn out. And because so much of fluid is going out, you are going into dehydration. Another example, epilepsy. Suppressed for many years by means of issues, invariably recurred and in an aggravated form when they were allowed to heal up, as Patchlin and others testify. Another example, he says, even for epilepsy, the earlier treatment was that they were putting some kind, they're making some holes in the tissues, in the muscles, putting some kind of metal in that, and you keep on oozing so that your disease, which is there in the brain, because epilepsy is a brain disease, it is going to be out. But then as soon as you remove that and that heals up, the epilepsy comes back. This has been observed by one person he named here, Patchlin, and many other testify. Many other they have agreed to. Testify is a word which was earlier used in the courts of the ancient time. You can go into the detail of it. But purgatives for itch and issues for epilepsy. Just now we saw these two examples. Purgatives for itch and issues for epilepsy cannot be more means what is the relation between the purgative and the itch, and what is the relation between the epilepsy and creating that kind of ulcer in the tissues by some metal? What is that relation? No such relation. Most heterogeneous. More dissimilar deranging agents. That means what? Cannot be more allopathic, more exhausting mode of treatment. Means purgatives for the itch and issues for the epilepsy are the most allopathic and most exhausting kind of treatment. Then are the customary prescriptions composed of unknown ingredients used in ordinary practice for the other nameless innumerable form of diseases. These likewise do nothing but deliberate and only suppress or suspend the malady for a short time without being able to cure it, and when used for a longer time, always add a new morbid state to the old disease. So, this is the whole crux of the matter related to the allopathic mode of treatment, which is quite similar to the second case, where when you are giving the stronger medication to the disease which are relatively weaker than this stronger medication, then what is going to happen? No such cure taking place. Yes, one thing is happening, that the disease which was under the treatment gets suspended for some time. And if you are giving stronger and stronger doses as patient is able to tolerate, mostly it is not able to tolerate. But if it is able to tolerate, then what is going to happen? You are going to have some more new form of disease, which is due to the eruption of the slept measm, and you are now a more serious patient than you were earlier was. So this is the whole second case, worth reading twice, thrice, many times. I believe that everyone could really grasp the real serious situation is casted by the allopathic ways of treatment. Only thing, the examples we read, they are really not in much of the practice, in present Western medicine practice. But they are rather now doing rather something more serious than all this. Like, for example, they are doing operations in the name of relieving you, curing you. They're removing some of the parts of the body and leaves permanent damage. And many more such examples are there. So you can just have an idea that time has changed. The old practices are abandoned, but then adopted new treatments nowadays are rather much more serious than Hahnemann quoted. So only answer to all this is, as we all understand, the law of similia works to cure. We should be very serious with each of our patient coming with any acute disease or any chronic disease, and once he is able to be cured with homeopathy, he will not be really leaving homeopathy. And that is how slowly the masses, the people will learn, though many mafias are not really allowing them to learn, but the pain and the difficulties, and especially pain to our nearer and dearer, they make us learn, and they make us understand that what kind of mafia way of things going on in the medicine. We all, and our pharmaceuticals of homeopathy, they are quite weaker to fight with this stronger mafia of the medicine. What all we can do is, the best way is, again, apply homeopathy. You reply them, we all have to reply them by caring our patient. One day, this mafia of the medicine will learn, because after all, they're also human being, and one day going to fall sick. What are they doing, mafia and all that? This mafia expression is another expression of the disease itself, mental disease, dominantly mental disease. And one day they will also seek for homeopathic treatment. I hope you will all agree with me. Thank you very much for today. And let us see if any comments. Today we have Dr. Johari with us. Thank you, sir. And Dr. Aditi Kapoor says, very true. So you can narrate your story, how very true. It will be very good for everyone else to learn. Thank you very much, everyone. Any questions, comments, I will be looking for. Thank you. Thank you, everyone. Thank you.